Albertans continue to struggle because of 6 years of deliberate UCP health care failures. Not only is this government failing to fix health care, they set it up to fail by sucking taxpayers' dollars out of our public system and giving it to their wealthy friends who profit from unwell Albertans. Hence, we have the corrupt care scandal and ministers with MH Care Rolexes. To the Minister of Health, why won't the UCP get back to basics and stop the American-style healthcare experiment?
Hear, hear.
And I'm pleased to again highlight some of the $28 billion and increasing investments we're making in our world-class public health care system. We just announced a major expansion, over 1,000 net new acute care beds for Calgary and Edmonton. We also announced that we're going to work through our surgical backlog by adding 50,000 surgeries over the next 3 years to make sure that more Albertans are waiting in clinically recommended times for their surgery. So, Mr. Speaker, our commitment to the public system is there. It's getting bigger every year.
Given that there is an inherent right to public health care because of the medicine chest clause in Treaty 6, and given that this UCP government continues to fail the responsibilities and obligations to consult Indigenous people or care for seniors, people with disabilities, vulnerable Albertans, will the Minister of Health tell us explicitly how this government intends on upholding the medicine chest clause with a two-tiered American-style healthcare system?
Hear, hear. In fact, when the members opposite were in government, they didn't take the opportunity to make sure that our Indigenous brothers and sisters actually had the health care that they needed. In fact, Mr. Speaker, when I became the minister, I embedded within my department a Department of Indigenous Health, Mr. Speaker, that is laser-focused on improving health care for Indigenous people right across this province. We have Indigenous navigators. We have an anti-racism toolkit. We are continuing to improve in that area.